In this current environment, I think that we do have opportunities. I think that because the education is so poor in pain management, and pretty much whether you're an opioid zealot or you're totally anti-opioid or any place in between, everybody agrees on one thing: people are poorly educated in opioid therapeutics. That to me is clear. Now, this may be bias on my part. I see this as an opportunity for PharmDs, and this is the reason why. For many, many years, PharmDs have not had provider status and still don't. And if you don't have provider status as a clinician, you cannot bill. You have a federal, Medicaid, Medicare, or whatever, and you can't bill. If that doesn't happen, then third-party payers are not going to pay you to see a patient. Now, in the VA and the DoD, and a few states, it is commonplace to have a pharmacist in an ambulatory care setting or in a hospital setting seeing patients, but they really can't be paid. And if they are paid, it's like an incidental to charge, and it's almost like not worth the time, right? So what I see happening is the more and more PharmDs that are trained, residency trained, let's say, in pain and palliative care as a specialty, and some of the other things that are going on, for example, medication-assisted treatment, these are opportunities, in my mind, huge opportunities for PharmDs. And it can be kind of a backdoor way into go back to the government, go back to Congress and say, you know what, we are professional people. We have an expertise that no other clinician has. And in fact, the clinicians that do have it, they don't even want to do it. We have an opioid crisis. Why not, even on a trial basis, set up some clinics with PharmDs and see what the outcome is, see what the value is, and see what the cost savings are. And by doing all those things, I really think that the opportunities for PharmDs, at least, would be huge. I mean, the opportunities go outside the pharmacy world, but nobody can practice in a silo anymore. So I feel like we have to, it's a team approach.